The government recently announced that autism now occurs in about 1 of every 150 American children, a new number that is adding to what was already a raging controversy, with parents' groups arguing with scientists over what causes autism and with politicians over funding for research. In the meantime, behavioral scientists are trying to identify the early symptoms so that a diagnosis can be made by the age of 1. Today, most children are left undiagnosed until they're 5. Researchers at the Mind Institute at the University of California at Davis believe if they can catch it early, they can change the way a child's brain develops. They have started testing their theory in toddlers like Christian Haven.
May I have crackers, please?
Please. Psychologist Sally Rogers, a pioneer in the field of autism treatment, started giving 3-year-old Christian intensive therapy about a year ago, hoping to alter the course of his autistic behavior. What was Christian's behavior like before you met him?
When we first met Christian, he didn't have any words. He didn't really have any play skills. He mostly threw things on the floor.
And she says he would throw 20-minute temper tantrums because he couldn't communicate.
He was really out of control. That they had to bolt the furniture to the walls because this 2-year-old was in danger of pulling furniture down on himself. You got the bubbles?
Rogers worked with Christian one-on-one, on her hands and knees, in his face, teaching him new words and forcing him to interact with her.
Yes, where's your tummy? Show me tummy. Show me your nose.
She believes that if treatment can begin this early, while a child's brain is still malleable, the results can be dramatic. Do you think that you're actually rewiring the brain? Do you think you're setting up new wires that wouldn't be there?
I think we certainly are creating new connections in the brain. That's what learning is.
But are you suggesting that this can be cured?
We don't know how to touch the biology of autism, but I do think that the behaviors that are associated with autism can be reduced to the point where they're not obvious anymore.
Now, you can't make that promise to everybody, can you?
No, you sure can't. There's a huge range of severity in autism. There's a huge range of reactions to treatments.
Okay, which one, the red one or the green one?
Christian is now able to talk with his mother, Jennifer, and even a stranger like me in multiple word sentences.
What do you want, Leslie? Circle?
Circle, that's what I was thinking.
Thank you.
Okay, let's make a circle. Okay.
Valerie Arias often wonders what her 13-year-old son Teddy's life would be like if his autism had been treated earlier.
What color lights do you want to put on that tree?
Blue.
When Teddy was about 6 months old, I had him in his car seat, and he just kept flailing his arm over his head. Well, my mother looked at him and she's like, "Val, I think Teddy has autism." At 6 months old, my mother told me that my son had autism, and I said, "No, he doesn't. There's nothing wrong with my baby."
You got mad at her.
I was very angry at
Yeah.
my mother. I didn't speak to her probably for about a year.
What her mother saw was that Teddy never babbled as a baby. He just screamed and grew increasingly violent. And you're saying there's nothing wrong with my child. You are in
Denial.
major denial.
I am in denial.
Valerie may have been in denial, but even doctors didn't diagnose Teddy's autism until he was 4.
You got 2 cards.
By that time, Michael, who's now 9, had been born. In all, she and her husband Aaron have 4 children, including Paige, 14, and 1-year-old Hayden. Right after Hayden was born, Valerie heard about a study at the Mind Institute on early detection of autism.
You're not going to jump?
It was focusing on so-called baby sibs, children like Hayden with an older autistic sibling. So she signed him up. Did you know at that point that autism does run in families?
I knew that the chances of having another child with autism were greater.
Right.
But I figured since Michael didn't have it, that everything was okay.
When psychologist Sally Ozanoff, vice chairman of research at the Mind Institute, started the study 3 years ago, she was hoping to drastically lower the age of diagnosis. Would you say that 18 months is your holy grail? That's what you're aiming for?
I'm aiming for 12.
She's tracking 200 babies from birth, like Gabe, a normal 12-month-old, being tested for his reactions to a new toy.
And he's very interested in it, and he communicates that to her with that great look, big eyebrows raising, smile, and then he asks for it without language. He's, I want that.
And this is typical of a healthy one-year-old child.
Exactly.
But when this boy Jacob is shown the same toy, he stares at it in silence, never reaching for it, never looking up at the examiner. There's no communication at all with the woman.
That's right. It's as if she isn't there, like she was an object-handing machine.
Jacob was later diagnosed with autism. Ozanoff also uses high-tech methods like eye tracking. The colored dot is where the baby's eyes are fixed.
I just love you to pieces.
A normal baby looks right in mom's eyes when she talks to him.
Those cute little cheeks. Hi, it's Mama.
But children who are autistic avoid eye contact, looking more at the mouth.
Are you sleepy?
Like most autism researchers, Ozanoff believes children are born with the disorder. She went into her study convinced she would spot the symptoms as early as 6 months.
And the truth of the matter is we cannot.
Diagnosing one-year-olds has proved just as perplexing. Repetitive behavior, like the way Jacob plays with his lid, looks like a clear symptom.
All he's doing is watching it wobble over and over again. Right. Something. Right.
But Ozanoff has found that not all one-year-olds who do this end up with autism. Her most reliable test so far is surprisingly simple.
Starting about 6 months, maybe even a bit earlier, if you say a child's name, they quickly turn and look at you. And you'll see this with Gabe.
Gabe. Hi.
That's all it is. Say his name, his head whips around, makes eye contact, and smiles.
And now Jacob.
The experimenter is going to walk behind him,
Jacob.
call his name 3 times at normal volume.
Jacob.
Oh my.
Jacob.
Wow.
So you see, he doesn't respond to his name.
But even with this test, only half the children who fail it end up having autism. Haydn was 6 months old when he was first evaluated, and to Valerie's relief,
Haydn! Hi there. Hi.
he tested on a par with children his age.
Haydn! Hello.
On one of her visits last year, Ozanoff gave Valerie a copy of her book on Asperger's syndrome, a high-functioning form of autism.
So I was reading this book, and through the whole book I just cried because I felt like I was reading this book about Michael.
Michael is her 9-year-old.
Excuse me.
Through years of speech and occupational therapy, no one had ever suggested that his problems, including his struggle to make and keep friends, could be Asperger's, until Valerie began asking questions. So now you're basically told you have 2 sons with autism.
Right.
You must have been just reeling.
I was. You feel like you should have pulled your genes out of the gene pool a little sooner, at that point.
And there was still the question of Haydn. His 12-month visit, a half year later, was distressing. He wasn't smiling anymore. He seemed to be regressing into his own world. And then
Haydn. Haydn. Haydn.
he didn't respond to his name.
I knew that my son wasn't hearing me. Everyone around me was saying, oh, he's just stubborn, he doesn't want to listen to you. But I knew that wasn't it.
And it's not hearing.
It's not a hearing issue. He can hear.
Despite Haydn's symptoms, Ozanoff felt it was still too early to tell.
I would hate to cause the pain and anguish of having another child diagnosed on the spectrum and then be completely wrong.
More and more parents are worried about the chances of having an autistic child, with some autism groups saying there's an epidemic, claiming a 60-fold increase since the 1970s.
The explosive increase that has been claimed is almost certainly not true.
Dr. Stephen Goodman, an epidemiologist at Johns Hopkins University in Baltimore, has reviewed autism statistics for the past 30 years.
The numbers, if they're rising, are not rising very quickly, if it's going up at all. So that's the good news.
If it's going up at all.
If it's going up at all.
There's no question more children are being diagnosed with autism than ever before. But Goodman, other respected epidemiologists, and autism researchers say that's because of something that happened in 1994 when the definition of autism was greatly widened. Since then, Asperger's syndrome and other brain disorders that were not included before have become part of the autism spectrum. On top of that, Goodman says there are no reliable numbers from the past to support claims of an exponential rise. Have you ever seen a 60-fold increase in any disease?
Not that didn't have a recognizable agent like an infectious disease.
Or like AIDS?
Or like AIDS.
Could there be a hidden source that we haven't identified?
Many people have looked very hard and they haven't found one.
One hypothesis has been that the mercury in childhood vaccines causes autism. But Goodman himself served on a national medical panel that found no evidence of that, though more research is being done.
Okay.
What's the youngest little patient that you've had so far?
I've had a 12-month-old and a 14-month-old.
For researchers like the Mind Institute's Sally Rogers, autism remains a daunting adversary.
Are you all done?
Despite Christian's gains from early treatment, children with more severe forms of the disorder often don't make the same kinds of strides.
That is really, really nice.
And Sally Ozanoff is not yet able to identify definitive, unmistakable early symptoms, although she still has 18 months to go in her study. When Valerie brought Hayden back for another exam at 14 months, Dr. Ozanoff and I watched through a one-way mirror. After testing normal at 6 months and showing symptoms at 12, Hayden had changed again.
See his eyes flick up to Ian and back to the toy.
He was making more eye contact and interacting with the examiner.
And he's laughing.
This is very reassuring.
But not entirely. It took 3 tries to get Hayden to respond to his name.
Hi, buddy. Hi there. You found me.
And he became fixated on that lid. The kind of repetitive behavior that sets off alarm bells in Ozanoff.
That is so
But
interesting.
he is doing it. He's very repetitive on this wobble thing.
With such a mixed picture, Ozanoff felt it was too soon to call it.
There are some encouraging signs, but there are some mildly concerning signs. And what we really want to do is join with you to keep monitoring him as closely as we can.
How are you feeling? You
Well,
think you got
I'm
it?
still leaning for optimism because, you know, he's such a good boy. He's a good kid.
Valerie had hoped to know by now if she has a third son with autism. But Dr. Ozanoff says she probably won't be able to tell her until Hayden turns 2 next October.